Hello friends, let us now learn let us now learn about the right lower lobe collapse. Okay, so if you see, if I draw a lung, this is the heart border. This is the second lung. Okay, fine. Now, in the right lower lobe collapse, this where is the lower lobe exactly? Even the heart will be something like this. Okay, right? So the oblique fissure will be somewhere like this. Okay, so there is collapse of the right lower lobe. So this oblique fissure will move posteriorly and medially. So number one, this is oblique fissure. This oblique fissure will move posteriorly and medially. Because of this, this is medially and this is posteriorly. And because of this, you will see presence of this triangular type of defect is seen here. Because of this. So this will result in triangular density is seen to be projected over the heart. Triangular density is seen projected over the heart because of this right lower lobe. Then, because there is collapse of this one, the right hyla, which should be normally present here, they are depressed. So the hyla which are present here, these hyla are also depressed. So you will see number 2, depressed hyla, depressed right hilum is seen. Okay. Normally, if you remember, you will see the right lower lobe pulmonary artery like this. But now, because of this opacity, this right lower lobe pulmonary artery is not seen. So this right lower lobe pulmonary artery is not seen now. Okay. Similarly, the right medial part of right dome of diaphragm is also not visible. Medial part of right dome of diaphragm is also not seen. Okay. Then similarly, here you will have vertebrae also. Over this, you will see presence of vertebrae like this. Right. So here, the vertebrae, regarding vertebrae, the lateral margin of vertebrae is effaced. Lateral margin of adjacent vertebrae is effaced. Okay. So here, these are the main important things which you see. So oblique fissure is moved posteriorly and medially. There is triangular density which is seen to be projecting over the heart. The depressed right hilum is seen. Right lower lobe pulmonary artery is not seen because it is obscured by this opacity. Lateral margin of adjacent vertebrae is effaced, and medial part of in the right dome of diaphragm. The medial part of right dome of diaphragm is also not seen. So this is what we see in right lower lobe collapse. Hello friends, let us now learn some important points about the lobar collapse, right lobar collapse. So in the right lobar collapse, first and foremost, right lower lobe collapse. In right lower lobe collapse, this is the collapsed segment of the right lower lobe. This is right lower lobe collapse. So here the oblique fissure, here there will be oblique fissure which moves posteriorly and medially. Then the right hilum which is present here, it is depressed because of this oblique, which because of this collapse. Because of this collapse, the right hila will get depressed, and here there is right lower lobe pulmonary artery which is generally seen is also not seen here, and the medial aspect of the diaphragm, especially the medial, this is the right dome of diaphragm. In the right dome of diaphragm, the medial aspect is obscured, and even in the vertebrae, the lateral margin of the adjacent vertebrae is also not clearly seen. It is also effaced. So in the lateral X-ray, if you see, the oblique fissure will move more posteriorly. Here you will see the collapsed part. Then if you see, this is the picture of the right lower lobe collapse. Here right lower lobe collapse, where this is the right lower lobe collapse where there is oblique fissure. Here, because there is collapse of this right lower lobe, this looks like a triangular density which is seen over the heart. Over the heart, you will see presence of a triangular density is seen. Okay, even the hilum which is said, that is also depressed, and you cannot see the right lower lobe pulmonary artery clearly. And if you see here, actually, if you see on the heart, we can trace the bronchovascular markings present on the heart. But in the presence of right lower lobe collapse, even though the abnormality here is not that evident as you see in the first picture. In the first picture, this triangle is clearly evident. It is clearly seen. But in the second picture, it almost looks like a normal chest X-ray. But here you can see the triangle which is seen here. Because this triangle is present exactly behind the heart, so as a result, it is actually obscured or it is not seen clearly. So in this state, if you actually zoom into this picture, normally you will see the bronchovascular markings which are also seen over the heart. But those bronchovascular markings are not seen in this picture. That is one way of identifying the right lower lobe collapse. And one more important thing is right descending pulmonary artery. Normally, we see right descending pulmonary artery like fingers, like little fingers. But these right descending pulmonary artery is not clearly seen here. So if you see here, these are the normal chest X-ray where you can see this lower lobe pulmonary artery. So this is lower lobe pulmonary artery which is seen. Whenever there is a density in the lower lobe of the lung, whenever there is lower lobe collapse, this lower part of the little finger or this right lower lobe pulmonary artery is not clearly seen. So by this way, we can diagnose the right lower lobe collapse. Thank you.